is to help you do everything you can to beat cancer or stay in cancer remission by making certain diet and lifestyle changes and taking the right supplements.
Many people hear the word cancer and immediately feel overwhelmed. Questions rush in all at once. What does this diagnosis really mean? What treatments will I need? What can I do to support my body? And very often, one of the first questions people ask is this: should I be taking supplements? Vitamins, minerals, herbs, powders, and capsules are everywhere. They promise energy, immune support, healing, detoxification, and even cancer protection. Friends recommend them. Family members share articles. Social media is filled with confident voices offering simple solutions. But when you're dealing with cancer, the question of supplements is not simple at all. Some supplements may help certain patients in specific situations. Others may be ineffective. And some can actually interfere with cancer treatment or increase risk. The truth is that supplements can be both helpful and harmful, depending on the person, the cancer type, the treatment being used, and the timing. In this video, we will take a calm, science-based look at supplements for cancer patients. We will explain what supplements are, why people turn to them, which ones may be considered safer in certain contexts, which ones raise concerns, and why it is so important to approach supplements carefully during cancer treatment. This is not about fear. It is about clarity, safety, and informed decision-making. What are supplements really? Dietary supplements include vitamins, minerals, amino acids, fatty acids, probiotics, and herbal products. They are sold as pills, capsules, powders, teas, and liquids. In most countries, including the United States and much of Europe, supplements are regulated as foods, not as medications. This is an important point. Unlike prescription drugs, supplements are not required to prove effectiveness before being sold. They also do not undergo the same level of testing for safety, interactions, or long-term effects. This does not mean all supplements are dangerous, but it does mean that the evidence supporting them varies widely. For cancer patients, this difference matters. Cancer treatments such as chemotherapy, radiation therapy, immunotherapy, and targeted therapy are powerful medical interventions. They are carefully dosed and monitored. Supplements, on the other hand, are often taken without medical supervision, even though they can affect the same biological pathways. Why cancer patients consider supplements? Many people with cancer turn to supplements for understandable reasons. Cancer and its treatments can cause fatigue, nausea, appetite loss, pain, anxiety, and sleep problems. Patients may feel a loss of control and want to actively support their health. Some hope supplements will strengthen the immune system. Others want to reduce side effects from treatment. Some believe supplements can slow cancer growth or prevent recurrence. These motivations are deeply human and deserve respect. However, wanting to help your body does not always mean that every supplement is helpful. In cancer care, more is not always better. Sometimes, doing less is safer. Talk to your oncology team. Before discussing individual supplements, one principle must be clear. Cancer patients should never start supplements without discussing them with their oncology team. This includes oncologists, oncology nurses, pharmacists, and registered dietitians trained in cancer care. Why is this so important? Because supplements can interact with cancer treatments. They can change how drugs are absorbed, metabolized, or eliminated from the body. Some supplements may reduce the effectiveness of chemotherapy or radiation. Others may increase side effects or bleeding risk. Even natural products can have strong biological effects. Natural does not automatically mean safe. Supplements that are sometimes considered safer. It is important to say this carefully. There is no universal list of supplements that are safe for all cancer patients. Safety depends on individual circumstances. That said, there are some supplements that are commonly used under medical supervision when there is a clear deficiency or specific need. Vitamin D is one of the most commonly discussed supplements in cancer care. Many cancer patients have low vitamin D levels, especially those who spend less time outdoors or have limited dietary intake. Vitamin D plays a role in bone health, immune function, and muscle strength. Some observational studies suggest that adequate vitamin D levels are associated with better outcomes in certain cancers, but this does not mean vitamin D cures cancer. When a blood test shows deficiency, doctors may recommend supplementation at appropriate doses. Very high doses without monitoring, however, can cause harm, including kidney problems and abnormal calcium levels. Vitamin B12 and folate. Vitamin B12 and folate are involved in red blood cell production and nerve function. Deficiencies can occur due to poor appetite, gastrointestinal surgery, or certain chemotherapy drugs. Supplementation may be appropriate when a deficiency is confirmed through blood testing. However, excessive supplementation without medical guidance is not advised, especially because folate plays a role in cell division, which is a sensitive issue in cancer biology. Iron, only when deficient. Anemia is common in cancer patients, but iron supplements should only be used when iron deficiency is confirmed. Taking iron unnecessarily can cause gastrointestinal side effects and, in some contexts, may increase oxidative stress. Anemia in cancer has many causes, and iron is not always the solution. This is why testing is essential. Omega-3 fatty acids. Omega-3 fatty acids found in fish oil have been studied for their potential role in reducing inflammation and supporting muscle mass in some cancer patients. Some research suggests omega-3s may help with cancer-related weight loss and inflammation, particularly in advanced disease. However, omega-3 supplements can increase bleeding risk, especially for patients undergoing surgery or taking blood-thinning medications. Dosing and timing matter. Supplements that require caution or are often discouraged. Now we come to a critical part of the discussion. Many supplements that are marketed as immune-boosting or anti-cancer raise serious concerns when taken during cancer treatment. High-dose antioxidants. Antioxidants such as vitamin C, vitamin E, beta-carotene, and selenium are often promoted for cancer patients. The idea is that antioxidants protect cells from damage. However, this is exactly why caution is needed. Many cancer treatments, including chemotherapy and radiation therapy, work by creating oxidative stress that damages cancer cells. Taking high doses of antioxidants during treatment may reduce the effectiveness of these therapies by protecting cancer cells from damage. Large clinical trials have shown that high-dose antioxidant supplementation does not improve cancer outcomes and, in some cases, may increase risk. This does not mean patients should avoid antioxidant-rich foods like fruits and vegetables. Whole foods are different from concentrated supplements. Herbal supplements. Herbal products deserve special attention. Herbs such as turmeric, green tea extract, ginseng, garlic, echinacea, St. John's wort, and many others are widely used. Some have biological activity that can interfere with drug metabolism in the liver. For example, St. John's wort is known to reduce the effectiveness of many medications, including some cancer drugs. Green tea extract at high doses has been linked to liver toxicity. Garlic supplements can increase bleeding risk. The problem is not that herbs are always harmful. The problem is that their effects are unpredictable, especially when combined with cancer therapies. Immune-stimulating supplements. Supplements marketed as immune boosters can be risky, particularly for patients receiving immunotherapy or those with autoimmune complications. Overstimulating the immune system can increase the risk of inflammation or immune-related side effects. Cancer treatment is about balance, not pushing the immune system in one direction without control. Why timing matters. One of the most important concepts in cancer care is timing. A supplement that might be acceptable after treatment may not be appropriate during treatment. Chemotherapy drugs are carefully scheduled to target rapidly dividing cells. Supplements that affect cell growth, metabolism, or detoxification pathways can interfere with this process. This is why many oncologists recommend avoiding most non-essential supplements during active chemotherapy, unless there is a clear medical indication. A crucial distinction. One of the safest and most evidence-based ways for cancer patients to support their health is through food, not pills. Whole foods contain complex mixtures of nutrients, fiber, and phytochemicals that work together in ways supplements cannot replicate. Fruits, vegetables, whole grains, lean proteins, and healthy fats provide nourishment without the risks associated with high-dose supplements. Research consistently shows that dietary patterns matter more than individual nutrients. This does not mean diet replaces cancer treatment. It means diet supports overall health and quality of life. A balanced approach. Video helpful, educational, or reassuring? Please consider subscribing to this channel. Our goal is to provide clear